Welcome back. Once again, we're going to continue on with the remaining facial bones. So on the last video clip, we talked about the left and the right maxilla, and we talked about the mandible, and we also went ahead and took a look at the palatine bone there on the list. So we've got just a few more to take a look at here. So the first one, the zygomatic bones on the left and the right. We actually talked about the zygomatic bones when we were discussing the temporal bones of the skull. So on the left and the right, there's your left zygomatic bone, looks like kind of like a Z, and there's your right zygomatic bone over on that side. And so they're pretty straightforward. There are no particular features you have to know, but do remember that right there on the temporal bone on each side, you have a zygomatic process, but that is part of the temporal bone and not the zygomatic bone. Also, your zygomatic bones, if we rotate the skull around this way, you can see where they're highlighted there. They have kind of a complex shape, and they actually form part of the lateral interior walls there of the orbital cavities on each side. All right, so they're pretty straightforward. How about your lacrimal bones? They're pretty interesting. Let me rotate the skull around this way, right there on the left, and right over here on the right. Those are your lacrimal bones. So they're fairly small, and they're located along the anterior, medial, inferior walls of the orbital cavities. Think about all your directional terms, and hopefully that made sense to you. The more we practice with those, the better you'll get at using all of those different terms. I'm going to deselect those for a minute because I want to hide some of the other things that are here. Get rid of the left and the right. Maxilla. And these are actually nasal cartilages that I'm going to dissect off. All right, the reason I did that is because I want to strip all of those things off and re-highlight the lacrimal bones so that you can actually see them in a little bit more detail. And then I'm going to zoom in right here. Do you see this little, hopefully you can see on the video, there's a little divot. Bring my pen up. In fact, I'm going to zoom in even a little bit. Well, it's not going to let me do that since I've got my pen up. The little divot that you've got right there within the lacrimal bone, that little groove, that is actually in conjunction with the maxilla on each side. There's a little divot in the maxilla as well. That is going to form an opening that leads to a duct. Okay, you've got an opening there that leads to a duct. Remember, a duct is a tube that carries secretions of some type from an exocrine gland, usually. And so that is an opening for what we call the nasolacrimal duct, which you know better as your tear duct. And so that's actually formed the opening to that allows tears from the eye to flow into that little tube, which leads to the nasal cavity. That's what we call our tear duct, but anatomically it's more officially referred to as the nasolacrimal duct. All right, so nasal, you can probably figure out where that part of the name came from. Let me rotate this back around. The lacrimal part comes from lacrimal glands. So those are your tear-producing glands. Those are exocrine glands because they secrete a substance that's going to pass through a duct and can lead to the outside of the body. And they're located up here in the superior, lateral, posterior portions of the orbital cavities. Those are your tear-producing glands. And then those tears flow across the surfaces of your eyes. That helps keep your eyes moistened. And but then they'll also empty into those openings there between the lacrimal and the lacrimal bones and the maxillae, and they'll enter the ducts, and that'll carry them to the nasal cavity. That's why when you're crying, in a harsh way, tears will run out of your nose because they're flowing into that duct at that location. Okay, and I brought our skull completely back up again. I'm going to rotate this around again and kind of zoom in. See if I can get this skull positioned a little bit better here for you. So if I rotate that around, hopefully you can see right in there. There's that opening for the nasolacrimal duct, and you can see that it is actually formed from that little divot there in the lacrimal bone and then also the maxillary bone on that side. Okay, next one on the list, palatine bone, we've already done that. Nasal bone, let's move on to that one. Let me deselect those. The nasal bones are really hard. You'll never guess where they are. They're up here at the bridge of your nose, and you actually do have two of them, left and right, and there is a little suture joint that exists between those where your left and your right nasal bones articulate. Remember, that means where two bones come together. Oops, let me deselect the maxilla there. So those are pretty easy. You've just got those two, and they're up here on the bridge of the nose. The rest of your nose is mainly composed of hyaline cartilage. So you have cartilage tissue located in there rather than bone. So those are easy. Vomer bone. All right, so if you guys remember when we were going over the cranial bones, you have a feature of the ethmoid bone right there that's called the perpendicular plate. And it forms the upper half of what we call the nasal septum. All right, a nasal septum, a septum is a wall, a division. So you have a wall that divides the left and the right sides of the nasal cavity from each other, composed of these little thin pieces of bone. The top half is actually a feature of the ethmoid bone again, that's called the perpendicular plate. And then let me light up the bottom half there. See how that bottom half kind of turned blue there? That's the vomer bone. So you have a completely separate bone that forms the lower half of the nasal septum. Let me deselect the perpendicular plate. So now you can see how the vomer bone connects in there. It's actually shaped like an old-fashioned plow, and vomer means plow or something similar to vomer. Means plow in German, and that's where it got its name. Let me deselect that for a second. Let me get rid of the right maxilla and the left maxilla, and I'm going to re-highlight the vomer bone and rotate it around. So you can see how it extends pretty deep back in there in the skull. Let me rotate the skull up this way. You guys can get a look from the posterior direction as well. So it sticks way back in there. A lot of times people are surprised how deep the nasal cavity extends backward into the skull. That's the vomer. All right, inferior nasal conchae. We did those, talked about those a little bit before as well when we were going over the cranial bones. So when you look into the nasal cavity like you see here, you will see down at the bottom portion, you've got these turbinates that extend outward on the left and the right side, or folds. They look like folds that extend outward. And then you've got, up in here, you've got another series of folds. And then way deep in the superior portion of the nasal cavity, you would have a third area of folds that are folding in toward the medial section of the nasal cavity. So all of those are called nasal conchae or conchae. And the superior and the middle ones are actually features of the ethmoid bone. But the inferior ones on the left and the right, they're actually their own little separate bones. And they're called the inferior nasal conchae. Inferior nasal left inferior nasal concha, right inferior nasal concha if you're just referring to one of those by itself. Let me refresh the view so you can see what those would look like in an intact skull. Yeah, so if we look up into the nasal cavity here, boom, boom. Those are your inferior nasal conchae. All right, so we actually finished up the facial bones. We're done with the skull. As I told you guys on the very first video for the skeletal anatomy, the skull is really the most complicated part of the skeletal system. And not that there isn't a lot of additional information to talk about from here, but the skull is by far the most tedious part. All right, and so what we're going to do next, we're going to continue on with the axial skeleton if you're following along in your study guide. But we're going to do, we've got one little bone in the neck we're going to talk about, and then we're going to move down into the trunk. And on the anterior side, we need to talk about the sternum, the ribs, and the clavicle. And over on the posterior side of the trunk, we'll need to talk about your scapulae, your shoulder blades, and then your vertebral column. and some of the features on the different types of vertebrae that you have.